Good morning again, everyone. My name is Roni, and I work as the Child and Family Program Manager at the Mental Health Association of Maryland. I want to welcome you all to our July Healthy New Moms webinar series. Healthy New Moms is a program of MHAMD, and we work to raise awareness about maternal mental health, infant early childhood, really mental health for the whole family unit in that new time period. And so today's session is being recorded, and this recording will be sent to you afterwards. And we'll talk about this at the end as well too. There will be certificates of attendance, but these are not CEUs. There will be a form where you can sign up to get your certificate of attendance. And so with that, I'm going to dive into just kind of giving an overview for today's webinar. The goal for today is to equip professionals with the knowledge and tools to confidently identify unsafe sleep practices, educate families using evidence-based recommendations, and promote safer sleep environments for infants. We'll explore the critical role of providers and how they play a supportive role in new and expectant parents, and we'll actually go through an assessment tool that you all can use in your practice to really implement safe sleep education. And so with that, I'm going to go ahead and share my screen and let me know if you all can see this. Looks good? Awesome, awesome. I'm seeing thumbs up. So, again, our topic today is Safe Sleep Saves Lives, equipping professionals to promote safe sleep practices. And I mentioned Healthy New Moms. And I'll talk about this more later on. This is a campaign of Healthy New Moms where we want to really raise awareness about unsafe sleep practices. And you'll see as we go through our assessment tool that there is a mental health component to, unsafe sleep practices and that education and awareness. And so our learning objectives for today, we're going to talk about identifying evidence-based, safe sleep recommendations. I'll do an overview of what the data is saying about, safe sleep practices, both, nationally, but also in Maryland. And then we'll spend the bulk of our time going through our assessment tool. And this assessment tool is freely available for anyone, and it assesses the risk and guides conversations that you can actually have with the families and the caregivers that you serve. And then we'll end with just talking about practical communication strategies. What can you actually say, right? I think that's the bulk of the difficulty sometimes is I don't have the words to say, and we'll talk about that as well too. I do want to, have a disclaimer that we will talk about difficult and personal subjects today. And I always love to start our Healthy New Moms presentations in this way. Feel free at any time to step away. You can take a break. These are, heavy topics that we'll be touching on, and we want to ensure that everyone's wellness and mental health is supported. And so let's start with the video. Let's start with the video. Some of you may have already seen this video. It's the Be More for Healthy Babies Safe Sleep campaign video. And we're not going to watch the full thing, but I wanted to kind of anchor all that we'll be talking about today in real life experiences, right? And so I'm going to stop sharing. I don't believe I shared my audio. But let's just watch the first couple of minutes of this presentation, and then we'll continue together. All right. And let me know if you all can hear this.
I'm Ayana Williams. I have one daughter. She's 12 years old, and I had a younger son. He would have been 11 months old. His name is Brandon Lawson.
My name is De'Ara, and I live in the northern part of Baltimore. I have a husband, 3 children, a 4-year-old, his name is Eugene. I have a 1-year-old, her name is Sanaya, and I had a baby boy, his name was Charlie. Charlie.
My name is Lottie Plumley. My son was born in Baltimore, Maryland on November 12, 2009. My son's name was William Woodward.
I basically got a phone call from another family member that was living in the house that the ambulance was at the home trying to resuscitate the baby and that they were rushing him to Hopkins. He was not in his crib. He was in the bed, in our bed.
When I woke up at 4:30, he was gone. We had found him dead in the middle of our bed.
On December 29th, Charlie passed away. He turned a month that day. That morning, he was in the bed with us. And when I woke up and looked over at him, he just wasn't breathing. If I had a chance to go back to December 29th, knowing what I know now, I probably would have changed a lot of things.
So we will stop there. Again, very heavy, things that we are hearing these moms share. But I think it's important, right, to anchor what we are talking about in real life experiences. And, we called this webinar Safe Sleep Saves Lives, right? Because of course there are instances that are unexpected, sudden, and we'll talk about those. But there are so many things that, research and the science and just different accounts, have pointed to proving that you can implement safe sleep practices and it will increase the chance of just protecting the infant and the newborn during that time. And so let's start with just defining some terms and acronyms. SWIDs, sudden unexpected infant deaths, and these are defined, as the death of an infant younger than 1 year of age that occurs suddenly and unexpectedly. And this is distinct from what we'll, define next, in that the cause of death is not immediately obvious prior to investigation. SIDS, on the other hand, sudden infant death syndrome, is the term used to describe the sudden death of a baby younger than 1 year of age that doesn't have a known cause, even after a full investigation. So the way that I like to conceptualize this is that SWID is the umbrella term. Under this, you can have SIDS, but you can also have things like homicide, metabolic disorders, overlay, neglect, undetermined, so many different things that might contribute to that unexpected death of an infant. But SWID is that umbrella term. Bed sharing, and these are some phrases that we'll hear as we go through our assessment tool. This is when parents and infants sleep together on any surface. You'll also hear medical professionals use the term surface sharing, but this can be a bed, a couch, or a chair, right? It's not just limited to beds. Co-sleeping. This is commonly used in publications, but a lot of the times it's a unclear term. And so instead you might hear, room sharing, sleep surface, or bed sharing. But it's essentially where, parents or caregivers are sleeping in close quarters with their infant and newborn. Wedging or entrapment. This is a form of suffocation where their breathing airways are compressed or obstructed because the infant is being trapped or confined, right? And this could be, being stuck between a mattress or a wall. It could be an object like a toy, whatever it might be. It's, hindering their ability to breathe and can lead to death. So let's look at the data. You will see in different studies 3,500 or 3,700 estimated SWID deaths per year. This is from 2022. And what we see broken down is that 41% of these deaths are attributed to SIDS, 31% unknown causes, and 28% accidental suffocation and strangulation in bed. In terms of state by state, I just pulled Maryland and DC's. Our rate is about 91.4 SWIDs by 100,000 live births, and in DC, it's 104.8. Now, the US average is 94.8, but we still see that this is a problem, right? In Maryland, in DC. And again, this is from 2022. So what the data might look like in 2026 might be different, right? When we talk about the age range, we're looking at the majority, 90% of deaths occurring before 6 months of age. And we see a peak or a spike 1 month and between 1 month, sorry, and 4 months of age. So what this shows us is that that time frame, I mean, the first full year of life is a vulnerable time period for the infant, but that time period in particular is, more vulnerable than the entire lifespan. And then when we're talking about the breakdown by ethnicity, American Indian slash Alaska Natives are 229.4 per 100,000 live births. For Black populations, 244, Hawaiian and Pacific Islander, 237, White, 83.2, and Hispanic, 61.6. And we'll touch on this, how, there are, different cultural considerations that we have to be mindful of as we're, providing this assessment and having those conversations, but also systemic factors as well, too, that might be contributing to this huge disparity in numbers. And so I want to start here before we go into our assessment tool. Think about your role, whether you're a doula, you're a therapist, a provider of some sort. How can you integrate safe sleep education and awareness into your work? With safe sleep awareness, it is a shared responsibility, right? It's something that we all have to do together. Raising awareness, talking about the things that are not so easy to talk about so that we can save lives, right? So that we can support caregivers and moms and families in supporting their infants. And so as a professional, as an advocate, or maybe you're just a loved one that cares deeply about this topic, you are positioned to observe, right? Making those observations, asking those questions, and sharing education, right? And through that, you never know what whose life you could impact and save. And so our campaign, this was a partnership that we did with BHSB, and the goal was to promote safe infant sleep practices, increase awareness, and equip providers. That was kind of our target population. We've expanded this to where now we're just seeking to really equip anyone that is interfacing with new moms and new families. But we have developed through this campaign three major tools and resources available for anyone: the assessment tool, which we'll touch on today, a resource sheet that overviews in a very concise way what we'll talk about in our presentation, but we also have included resources in there. And then we also have a video that we'll watch a couple minutes of today that accompanies the assessment tool. And so what is this assessment tool, right? This is a tool that helps you identify who is most at risk of sudden unexpected death in infancy as a result of unsafe sleep practices. The questions and the way that we phrased it allows you to identify and map out risk factors. What the goal is with this assessment tool is to both bring education, but to assess, right? So as you are going through this with the caregiver or the family that you're working with, you're both assessing, but you're also ensuring that, evidence-based information is being provided as well, too. So it should be completed together with the caregiver. You'll see me emphasize this throughout our presentation. This is, a tool that is collaborative. It's not meant to lecture the family or to lecture the caregiver, but it's meant to together come up with, better safe sleep practices and have a, genuine conversation about possible unsafe practices that are going on. And so it's to foster that shared conversation without making them feel targeted, judged, or criticized. In addition to the resources that we'll talk about today, I highly recommend BHB's website, healthybabiesbaltimore.com, because they have an entire page dedicated with more videos, more infographics, and more resources on safe sleep. So let's dive in. This is a QR code that will actually take you right to the assessment tool. And where we're going to start is on page 1, our love approach to the interview. What you'll see is that we start with an intro just to kind of, in addition to the video, just to kind of get a shared understanding of what this assessment is. And then we dive into this acronym LOVE. Again, the approach is collaborative. So as you start in, providing this assessment, invite caregivers to answer questions with you and to document the responses together. You can both use this tool digitally or you can use it on, pen and paper and write things down, as you're going through the questions. But you want to explain, in whatever way you see fit, that this is not an interrogation, it's not a test. It's really an opportunity to better understand where they are and to provide evidence-based information about safer sleep practices. And so, what is love? This is our anchor in terms of how we approach the assessment and the interview. L stands for listen. We listen with empathy when the family describes current sleeping practices. For some of us here, we have background in safe sleep, right? We understand that there are several national and statewide safe sleep campaigns going on in Maryland and nationally, but some families don't have that awareness, right? They're not aware of the practices for one reason or the other. And so as we are listening to them, we come with empathy, we come with understanding. O is open-ended questions. You want to steer clear from the yes or no type of questions because, again, this is a conversation. There are some questions in the assessment that are yes and no just for the sake of getting the information. But as you ask those questions, engage them further in open-ended questions. So, for example, bed sharing. Why do you prefer to practice bed sharing? What makes it hard to maybe practice some of the safe sleep practices that I'm recommending, right? Is it that, there is a bonding difficulty going on? Is it that there's maybe guilt associated with it? When you ask open-ended questions, it gives room for you to get more of that information. V is validate. You want to acknowledge and validate the family's desires. Families across the board have different cultural practices, backgrounds, things that have been passed on for generation and generation, and we don't want to discredit that. We want to validate what their desires are and what they hope to achieve. And that kind of goes back to the open-ended questions, right? What are your goals, right? What are you hoping to achieve during this time period? And how can I validate that without, affirming unsafe practices? And that takes us to E, education. Let's say you get a response that is an unsafe sleep practice. The response is to provide education, offer education. We get new research all the time in this area. Babies born preterm, like yours, are at more risk for dying when bed sharing, right? As you can see from just these two quotes, we're not diluting, right, the truth, but we're providing accurate education to ensure that they're fully aware. So, while any infant in an unsafe sleep environment is vulnerable to death or severe disability, there are circumstances that increase their vulnerability. And this goes into predisposing vulnerability and risk factors. So, this is now moving us onto page 2 of this assessment. You can scan this QR code and it will take you right there. But when we talk about predisposing, vulnerabilities, there are 3 things that we first need to kind of frame when we're asking questions about ourselves, right? The first thing is to watch our reactions. Sometimes our facial expressions and our body language can speak and say things before we even do, right? So as you're hearing them, respond to the questions that you'll be posing, be mindful of how you're presenting, right? Stay neutral and supportive, and then practice active listening. You want to demonstrate that the caregivers are being heard, right? You want to demonstrate in how you're speaking, responding, your facial expressions, your body language, that they are being heard and not being lectured to. And so that looks like maybe repeating what they've said, engaging them in further questions, just practicing that active listening so that they feel more open and answering questions. So, in terms of the predisposing vulnerabilities, you want to ask, and this is on the assessment, these couple of questions about factors that were present during pregnancy and currently for the baby. Low birth weight, respiratory illness, prematurity. Are they under 6 months of age? Because remember, from 1 month to 6 months, that's a peak time for vulnerability. Smoking and or substance use in pregnancy. And in our video that we watch that accompanies this assessment tool, we'll see how you can, in a non-judgmental way, ask parents and caregivers about this. But then also fussy, colicky, or difficult to soothe infants as well too. These are just factors that you're asking that might increase their vulnerability. In terms of risk factors, we're looking at smoke exposure, prone side, prone or being prone to their side position, soft surface and or beddings, surface sharing. So again, that's also termed as bed sharing, caregiver drug or alcohol misuse, overheating, and caregiver mental health conditions. We'll actually dedicate some time to talking about how the caregiver's mental health conditions can also impact this as well too. And so when you're moving past the kind of yes or no, those were kind of the yes or no questions, and you're asking more open-ended, guided questions, these are some of the things that you can ask. Is the baby always put to bed on their back? What does your baby sleep in, and is it appropriate? Is the family able to ensure room temperature stays around 72 degrees Fahrenheit? Do you plan to manage safe sleep for your baby in different circumstances, right? So we're thinking about beyond just at home, what does safe sleep look like? Does anyone in your household or anybody who cares for your baby smoke? Or this can also be drug misuse. Do you ever take your baby to bed with you? If yes, you can follow up by exploring their reasons for this. Do you share your bed with anyone else, such as pets, other people in the home? Does anyone in your household or anybody who cares for your baby or drink alcohol or use drugs? And then this is what we'll focus on for this next section is any primary caregiver experiencing extreme stress, mental health decline, or challenges. And the reason we wanted to include this in the assessment is because they're connected, right? If you are presented with a mom or a caregiver or a family member that is struggling with their mental health, it can be difficult in the midst of that to be thinking about all the other millions of things that they're being tasked with, right? But you want to consider their emotional well-being. Ask them how they're feeling and how they're coping with this new time. Right? Create spaces for caregivers to share their concerns. Connect caregivers with appropriate resources and pay attention to changes. Whether you are interfacing with them once or, several times over their, period of giving birth and even after postpartum, you want to pay attention to signs and symptoms. And we'll talk about this next because they might not say, I'm struggling, or they might not say, I'm dealing with a mental health, condition. But if, as, advocates and professionals, we can identify signs and symptoms, we can then ask the appropriate questions. And so, what are those signs and symptoms? Look at mood changes. This can be sadness, anxiety, irritability, feeling overwhelmed. We know the period of baby blues is, expected to last a couple of weeks. But if these, considerations and changes are longer lasting and they're heightened, it might be a sign that something else is occurring, right? Behavior changes. Are they withdrawing? Or is there a loss of interest, emotional distress, hopelessness, guilt, or helplessness? And even looking at the caregiver-infant interaction. Are they vocalizing or are you noticing difficulty in bonding or reduced responsiveness? And then safety concerns. If they express unsafe thoughts or actions, these are all things to be considerate of. And again, these are signs and symptoms. You want to follow up with more questions, get them to the help that they need if maybe that's not something that you're able to do, but just being mindful of what's going on with the caregiver is really important. So what we'll do next is listen through what this assessment actually looks like in practice. And as we are listening, think about, did the care worker establish rapport? If so, how? And did the care worker sound empathetic and non-judgmental? So I'm going to go to our next video and we'll listen through. I do have this sped up because it's a little bit longer, but it's still really good content.
A little bit more about Micah and ensure that he is safe at night when he's napping and when he's napping. Feel free to ask questions as we go, and afterwards, I'll give you some more info on safe sleep. Can you tell me a little bit about Micah's birth? Was he born close to his due date?
Yes, he didn't want to come out. He was actually 2 days late.
I bet that was a really long 2 days. Do you remember what he weighed at birth?
Yep, almost 8 pounds.
And how old is he now?
He'll be 3 months tomorrow.
Has he ever had any trouble breathing or respiratory issues?
Thankfully, no, he hasn't.
And has he been fussy or colicky or just generally difficult to soothe?
No, everyone tells me he's an easy baby, but he's my first, so I really wouldn't know.
So this question is a little sensitive, but we do have to ask everyone. Did you use alcohol or any other substances while you were pregnant?
No, not even a single glass of wine.
Sounds like you take your baby's health very seriously. Does anyone in your household or anybody who cares for Micah smoke?
No, it's just me and my mom here, and she quit smoking when I was a kid.
What about drugs or alcohol? Does anyone who cares for him use those?
My mom does have an occasional glass of wine at night.
Okay, thanks. Do you ever take Micah to bed with you?
Well, not at first. I always lay him in his crib, but I'm breastfeeding, and sometimes it's easier to bring him in bed with me to nurse.
Okay. Do you ever fall asleep while nursing and then he stays in the bed with you?
Occasionally. I mean, it happened a few times, but I try to put him back in his crib.
As you know, it's safest to have him in his crib. You can set an alarm on your phone to vibrate when it's time to put him back, or maybe turn on the TV so it's harder to doze off while he's in the bed.
Those are good ideas. His crib is right next to my bed, and he usually stays asleep when I put him back.
Do you share your bed with anybody else or maybe a pet?
No, it's just us.
Being a new parent is really tough, and it can be overwhelming at times. How have you been feeling since he was born?
It's really nice to have someone ask about me. I'm okay. It is hard at times, but my mom helps a lot. She watches him when I'm at work during the day.
And how does your mom seem to be feeling?
She loves being a grandma.
That's great. When you or your mom put him in his crib, is he always placed on his back?
When I put him down at night, yes. But when he naps, my mom puts him on his stomach sometimes. I told her not to, but she says that I always slept better on my belly as a baby.
We've learned a lot in the last 20 plus years about safety. It's essential that Michael be placed on his back for sleep, even for short naps. I'm going to leave you with some more info that you can share with your mom. I'm sure she wants her grandson to be safe. Do you think she'll listen?
I think she will. I'll show it to her.
And what does your baby sleep in?
He has footy pajamas. I don't keep anything in the crib like blankets or bears because I know that's not safe.
Great. What about like a crib bumper or a blanket?
No, it's just him.
And what temperature is your room at bedtime?
We keep it really cool, around 70 degrees.
That's perfect. And remember, if you're comfortable in that temperature, so is he. Have you thought at all about when you may travel and where he'll sleep then? Or if you had some alcohol at a party and it wasn't safe for him to be with you?
I work too much to travel or party, but if we did go somewhere, I'd bring his pack and play for sleep. And if I go out, my mom will take care of him at night.
It sounds like you've thought a lot about him sleeping safely. You're doing great. We like to use the acronym the ABCDs of safe sleep to remember the most important parts of sleep. They stand for A, alone, B, back, C, crib, D, don't smoke. You're doing all of these things to ensure that Micah stays safe while sleeping. I also have some resources to share with you and your mom as well.
Thank you.
All right, so we will stop there. And I want to throw it back to you all. Do you feel that the care worker established rapport? And if so, how? And then also, did the care worker sound empathetic and non-judgmental or the opposite? And you can feel free to come off of mute. I'll also be checking the chat as well too. But what stood out to you from the video? And, this of course was a practice. Sometimes it won't go super smoothly like that, but it does give us a good idea of what it will look like in practice. So let me see if anything is in our chat. Or you can also feel free to come off mute. Okay, Kimby says non-judgmental and encouraging. Yes, I agree. Very encouraging, especially in the questions that were asked and the follow-up, highlighting that the caregiver was already doing the ABCDs, maybe without even knowing it as well. So I definitely agree. Anyone else? What do you think about this practice? Very validating, talked about baby by name. Yes, that's really important and reinforced her, right? Instead of just referring to the baby as the baby, the care worker called the baby by name, Micah, right? And reinforced her. Yes, absolutely. Anyone else? What stood out to you? One thing I, want to highlight as folks are still dropping things in the chat is the question about substance use, right? The way she asked it wasn't judgmental. It was very straightforward. She even kind of gave a disclaimer like, hey, I know this might seem a little bit personal, but is this, happening? And in response, they were able to answer honestly, right? And so it's important, even when we start getting to those touchy topics, to just ask and be very direct, right? And so Cindy says yes to both questions, non-judgmental questions, but gentle suggestions and recommendations. Yes, acknowledge what she was doing right already. And again, this is like a practice thing that was done when we started this campaign, but sometimes it won't flow as easy, right? But even still, it's those gentle suggestions and recommendations, just dropping nuggets of education, evidence-based education and research as we are providing this assessment to caregivers and families. So, in terms of what is recommended or encouraged, firm, flat, level. Super easy way to remember this, firm, flat, level. And this is from the NICHD Safe to Sleep site. No toys, soft object, comforters, quilts, pillows, or blankets. For a lot of families, it's instinct. There's a baby shower, there's an event, let's get pillows and blankets and, toys. But when we are, informing families about safe sleep, firm, flat level, and those things should not be present with the infant and the newborn, as they are sleeping. Because again, it might lead to the wedging or, the blocking of airways, the entrapment, all of those different things that we touched on before. And so, in terms of what to do next, let me just make sure. Okay. In terms of what to do next, you want to check whether the family knows what the standard safe sleep advice is, check their understanding of the advice and why it's so important. Be prepared for pushback. And I'm going to pause because it seems like my Zoom. Okay, it's still here. I'm sorry. I thought I lost you guys. It looked like it quit on me for a little bit, and I've been having Wi-Fi issues. So let me know if you all can't hear me or it's glitching out. So, what to do next, right? You want to check whether the family knows what the standard safe sleep advice is. And you do this through those assessment questions that, we talked about before, because as you're asking those questions and you're getting those responses, it gives room to, share those nuggets of education, check their understanding, and also emphasize why it's important to follow it. It's not to scare them or to make them, feel judged or lectured again, but it's to just emphasize that these practices can really limit some of those stories that we heard of in the beginning, right? And be prepared for pushback. Again, we kind of touched on this before, but there are different traditions and desires, passed down that can, lead to this conflict between what we're seeing in the data and what families are doing. And so how we prepare, ourselves for pushback is really important. And I want to throw another question at everyone. What is something you think you may receive pushback on, or maybe you already have, right? Maybe you already practice, safe sleep education in your line of work and you received that pushback, but how do you respond, right? How do you validate? How have you or how would you validate when those things occur? And you can again drop it in the chat or come off of mute. And let me see. Okay, I see Brittany saying reflux. Yes, if you could expand on that a little bit. What do you mean by that? Or is maybe that something that you've experienced where people push back on you on that topic? Yeah, because they want to prop baby up because baby has reflux. Yes. Yeah, that is something that, we can receive pushback on. And interestingly, and I'll share all of the resources at the end. There's actually, I believe it's on the Safe Sleep site. for NICHD, they talk about this, that this is a common misconception, but it's important again that firm, flat, and that there should be nothing in their environment during that time period. So thank you. Anyone else? What are some things that you might receive pushback on or have already? And if not that, how can we respond in a way that's validating while also ensuring that, education that's evidence-based, that's research-backed, is being shared with the families that we're serving? Yeah, the mattress is too hard and the pack and play. Yes. And that's why we touch on soft surfaces are actually discouraged, right? Because those can lead to that entrapment or the suffocation. So yes, that's definitely something that you can get pushback on. All right. So you all can continue to drop those in the chat. I will move forward. Let's kind of, think through what someone might say and then the response. I don't want my baby to sleep alone. I like her close to me, right? That's something that a lot of families and caregivers might, want to practice and might actually say. Unfortunately, co-sleeping is really dangerous. Remember, it doesn't take much for a baby to suffocate. Co-sleeping is a common practice in some cultures, and while it's wonderful to observe cultural traditions, some may need to be adapted. Sharing your room with your baby is a great alternative to keep her close and safe, right? So we're not discrediting what this caregiver might have said, but we're bringing the education, right? And we're being very direct about it. We're not trying to diminish their culture and their practice, but we're also emphasizing that it can be dangerous. And this is an alternative that you can do instead, right? Sharing your room instead of bed sharing or co-sleeping. So the next thing, won't my baby get cold without a blanket? And again, we're thinking about this in the first month up until that first year period, in particular, the first month to the 6 month period as well too. Won't my baby get cold? You can dress your baby in a sleeper for warmth, but do not use blankets or allow your baby to get too warm. Overheating can be a risk for SIDS. A good rule is to dress your baby in the same number of layers that you are wearing. If the room temperature is comfortable for you, then it is also comfortable for your baby. And this is another misconception. Of course, we know based on different biological factors, this might differ. Of course, seeking the advice of a doctor or pediatrician. But oftentimes, how we are feeling in terms of temperature translates to the baby, right? And so, kind of paralleling that how many layers you're wearing should be sufficient for the baby as well, too. And one thing, that I'll point out too is when we're using, acronyms like SIDS, defining them, right? Making sure that we're not using terminology that's only familiar in, medical spaces, but defining what those terms are as well as we're, speaking with families. So now we're moving to page 3 of this assessment tool. And again, you can scan this if you're following along. And this is the ABCDs. This is actually something that is used beyond the Healthy New Moms campaign. It's used nationally, but it's an easy way to remember what to actually do in terms of safe sleep practices. And so A stands for alone, B stands for back, C stands for crib, and D stands for don't smoke. Essentially, the goal is to reduce risk, right? Based on what we spoke about before with SIDS and SWIDS, there are some deaths that are unfortunately after investigation still unclear, unexpected, but there are things that we can do to reduce that risk. And it's the ABCDs. Again, alone, back, crib, and don't smoke. And this don't smoke is extended to, substance use in general, right? When we are around infants and babies during that time period. And so let's say there is a parent or caregiver that really is adamant on choosing to co-sleep. You want to emphasize these 3 things about why that can drastically increase the infant's risk of death. And in some studies, 10 times more, right? Bed sharing when the parent's alertness is impaired. And that can be due to fatigue, medications, it's the postpartum time period. So many changes going on can greatly, increase that risk of death. If the parent is a smoker, right, that suffocation can also increase that risk of death. And then again, those soft surfaces, such as a couch, an armchair, a rocker, a waterbed, can increase that risk of death. And so again, we're sharing information, right? We're sharing the reality of what can occur when we practice unsafe sleep practices, and we're providing alternatives as we're sharing these data points. So what if they still have reservations? Our role as advocates, professionals, loved ones, wherever you fall on that spectrum, is to share information. If you are a provider or a therapist or a doula or a nurse, you might not be able to literally go into their home and, rearrange their nursery, right? But you can be adamant about sharing information and encouraging them to adopt safe sleep practices. And so what are some of those additional risks beyond just safety, right? It can be not learning how to fall asleep on their own, development of anxious behaviors, right? That kind of points to attachment styles and bonding, poor quality of sleep for the caregiver, right? And limited space for intimacy with your partner in those contexts. And so these are things that you can highlight to say, you know, yes, I know you're really adamant on practicing co-sleeping, bed sharing, soft surfaces, all of those things. But just be mindful that there are also other risks that can occur beyond just the safety of the newborn during that time. Recommendations to make, right? A safe alternative to bed sharing is room sharing. I think we heard this in the video and we talked about this on a previous slide, which is where you're in the same room, but you're not on the same bed or on the same couch or you on the same surface. They're still able to keep track of their child, watch over them, but it's a more safe alternative to that. And even if they're still co-sleeping, emphasize the importance of continuing to follow all other safety guidelines. If you're in the home, assess the sleep environment. Let's say you're doing home visiting, or you're a doula in home or a nurse in home. Identify steps the family can take to create a safe environment. And again, this is doing it together, it's collaborative. Let's have a conversation about this. I know you're doing X, but have you considered doing Y instead? You can suggest moving the bed away from the wall, arranging the furniture to place a crib near the bed, and helping families identify where to store items being stored in the crib. So let's say, families and caregivers are just kind of putting things in there for storage and you're in the home, right? Let's walk through and maybe identify, as the family is comfortable with, identify other places to put storage items. Help avoid inadvertent bed sharing, so removing pillows, loose bedding from the bed before feeding, set alarms, engaging in activity, and sharing strategies for soothing a fussy infant, right? And this is really important because a lot of the times with bed sharing and co-sleeping, it's not from a place of, actively wanting to harm their infant or their newborn. Never, right? But it's maybe that they have a fussy infant or they are in an environment where they feel like that's what's best for their infant or newborn. And so providing practical strategies and alternatives can really help them during that time. Encourage the caregiver to seek solutions for colicky and hard to soothe infants from a pediatrician and provide resources for substance use and mental health treatment. And we'll talk about that as well at the end. So this is where I'll end. I know I shared so much information. These slides will be shared at the end, in addition to the resources that I'll touch on next. But remember, families are overwhelmed during this time, right? They are navigating the postpartum period, financial stressors, cultural stressors, social support might be limited, so many different things that are going on in their lives. And this assessment is not meant to add to that, but it's meant to actually benefit them. And that together we are coming up with an approach that can help the family long term. And so when you're introducing a new service or even this assessment, such as home visiting, such as, a 988 line, a hotline. You want to discuss practically how these services can complement and coordinate with their providers and what they are already doing. It shouldn't feel like another bucket list and long laundry list of tasks that they have to do, but it's a service that is really going to benefit them and benefit their newborn or infant. And so these are some of the references that I talked about throughout our presentation today. But these are also some resources, right? The Maryland Family Tree 24 Parent Hotline, 988. I know a lot of us know this, but this kind of goes into the behavioral health, mental health element of things. But again, I can't emphasize enough, bemoreforhealthybabies.com is a super helpful resource. That's where I got that first video that we played. The National Safe to Sleep campaign, Healthy New Moms. At the end, I'll show a QR code where you can access all of the resources that I touched on. And then UMD Center for Infant and Child Loss and Cribs for Kids Safe Sleep Academy. And I know that there are a ton more. You all probably have some resources as well too. And so it's just important as professionals that we stay up to date on these things so that we can help the families we serve. And so that is it. I want to thank you all so much for attending this webinar, this training. If you scan this QR code, it will take you to the Healthy New Moms link tree. And if you scroll at the bottom, you will see the list of all the resources that you can access for free, in addition to one or two national resources as well that we also maximize in the program. So I am going to stop sharing. We do have a couple more minutes left. I don't know if there are any questions or just any thoughts that anyone, had on this subject matter. Awesome. So not seeing any. Again, I want to thank you all for joining us today. I want to, thank everyone that came to learn about Safe Sleep. Again, this is a campaign that we are doing year round. We're able to do this presentation actually in more depth. We have a longer version if this is something that you're really passionate about at your organization that we can do. Certificates of attendance are available. I believe the link was just dropped. You can fill that out and a certificate will be emailed to you. These are not CEUs. I do want to plug that on September 15th, we're hosting our next webinar, and the title is Strong Starts, Infant and Early Childhood Mental Health and Supporting Families from the Beginning. This will touch on the role family members and providers play, and will also touch on abuse and neglect as well too, and how we can identify when that might be happening in the family unit. If you're interested in serving as a guest speaker for an upcoming webinar, you can click that link that was just dropped in the chat and someone from the team will reach out to you. And that is it for today. I want to thank you all again for the awesome work that you do to support moms and families and caregivers across Maryland. If you have any questions, you can reach us at info.hnm at mhamd.org. Info.hnm at mhamd.org. So again, thank you all so much and have a great rest of your day.